Welcome to or back to the Suburban Sheepdog Channel. I'm Grant and I'm the host. So this is the place where those of us that want to take care of family, friends, ourselves, this is where we gather to exchange information. In this episode, what we're going to do is we're going to look at lockdown medicine. So what is lockdown medicine? Well, lockdown medicine is the realization that during the COVID-19 lockdown in the past, or maybe something coming, it looks like, we may be in a situation where we're not able to get out of the house, or we don't want to get out of the house. So it's not unimaginable that the things that you normally can depend on, your supply chain for medication, for getting supplies, for getting medical care, those things can get disrupted. It's not crazy to think about anymore, is it? So what we're going to do in this particular episode is we're going to highlight a full-length video that I have broken into two pieces, two episodes. We did that for the sake of time. Well, I interview a medical doctor that I used to work with, so I called in a favor of sorts. Well, it wasn't hard because Dr. Mike's a good friend and he kind of really wanted to do this project. So sit tight, hang on, it's going to be kind of quick moving, but we're going to cover a few things that I think you should know before you get into another situation where you can't or don't want to get out. Let's let it roll.
No matter how you approach it, people I think probably don't normally think about this, but if you're going to have enough macaroni and Kraft macaroni and cheese put back for 3 months if you need it,
Yeah.
wouldn't it make sense to have your blood pressure medication, etc., back as well? Because, either one, starvation or a stroke can kill you. But in addition to that, you're going to want to, of course, be prepared for things that might happen a little bit more severe. And if you're saying that these situations do not provide for access to emergent care, well, guess what? You're now the emergency physician.
Yeah.
So what are you going to have? What should you have for that? Let's start with infection. Infections, broadly speaking, you're going to talk about two different types, the exterior and the interior. In interior, you're talking about basic gastroenterology. You're talking about parasites and things like that you can get in these type of situations. How are you going to get a prescription for a prescription medication for a diagnosis you don't yet have? How is your doctor? Is he going to be open to that? That's the internal. Externally, that's much more common. It could be a burn. It could be a scrape. If you're walking long distances for whatever reason, a simple blister can take you down. It can turn into an infection, which can turn into gangrene, which can turn into the need for an amputation, etc. In today's society, we don't think about that. 200 years ago, everybody knew that. But we're talking about putting ourselves back in a situation much
Right.
more akin to 200 years ago. So number one, keep yourself out of that situation. Don't get the fracture. Don't get the blister that gets bad. But if you do, there's a couple basic things. The simplest thing I think is Neosporin.
Right.
Just keep a tube of Neosporin around. If you get a burn, if you get a scrape, if you get a blister, you can bandage it, etc. But Neosporin is a broad spectrum antibiotic that's going to cover a lot of things that at least you can treat short term. What about systemic antibiotics? Well, again, is your physician going to be open to the idea of giving you a prescription for a broad spectrum antibiotic just to have around, just to keep in case this sort of thing sort of happens so that you could treat it if it happened? And again, when I say prepared, of course, the first thing that some people are going to come to mind, oh, these are preppers. This isn't really prepping. This is just a couple basic things. If this is prepping, so is having Band-Aids in your medicine cabinet in your bathroom.
Right.
And then there's the potential for bleeding, which of course can lead to a abrupt demise. The basics always apply. You apply pressure. You apply pressure directly. You apply pressure to the artery that's feeding that area if you can. But there's one device that I've found kind of interesting, and it's called the Israeli bandage or Israeli device. Now, when you say bleeding, you hope it's smaller vessel rather than larger. You don't want to lacerate your femoral artery. You'd really rather have cut your calf a little bit. But
Right.
either way, bleeding, as they say in medicine, all bleeding stops. for that, and for a lot of different things. Just some basic gauze bandages, some of the ACE wraps, the stretchy ACE wraps, the kind of light brown things that,
Right.
things like that you can use to hold a splint in place, hold a bandage in place.
Yeah.
Those are the type of things you keep in your closet in your bathroom,
Right.
along with your medicines, etc., that you can be on top of these types of situations should they arise. Because, as the idiom went, for the want of a nail, one little thing you didn't consider,
Right.
and it blossoms into something that ends up being potentially fatal. Well, have the nail. Just
Right,
get
right,
the nail
right. Yeah.
and take care of the problem early on, and you won't have to deal with all that stuff later on. Anybody who knows how to sew can actually do the superficial stitching. It may not be a plastic surgery closure, of course. It may not look good down the line, but in terms of actually just getting the thing to a post to heal, if it's not too deep, somebody can do that for you,
Right.
who's sewn before.
Okay, so there it was. Like I said, it's kind of fast moving. That's on purpose. Wanted to make this a short video and be able to link to 2 longer videos. This is really important stuff and could literally save your life. All right, so look forward to seeing you in the next episode. So you don't miss episodes, go ahead and subscribe now. Hit the notice button. We'll see you here in just a little bit. Episodes 1 and 2 will be linked to in the description below. Thank you very much. Stay safe. God bless.